Hello guys, I'm Dadali, a certified personal trainer. So as I promised you that I'm gonna make a explain a video of entire ACE manual book. So today, let me not waste your time, guys, and start with the chapter one: role and scope of practice for personal trainer. So guys, in this chapter we're gonna cover like the scope of practice and knowledge, skills, and ability of a certified personal trainer. Then scope of practice for a certified personal trainer. So we're gonna discuss like the benefits from regular exercise. What are the benefits we're gonna get from the regular activities. The first benefit what we get is the reduce of risk of many adverse health outcomes. Some physical activity is better than none. You heard me right, guys. It means like you gotta do some kind of physical activity instead of doing nothing. The coming towards the third one, for most health outcomes, additional benefits occurs as the amount of physical activity increases through higher intensity, greater frequency, or longer duration. It means that if you do the more intensity and more duration, you're gonna get benefit out of it. You're gonna get more benefit out of it. Most health benefits occur with at least of 150 minutes a week of moderate intensity physical activity such as brisk walking. Additional benefits occur with more physical activity. It means, guys, the minimum physical activity on moderate physical activity what you required is 150 minutes per week. This is the most important question. So if you guys like trying to clear this exam, this is the most important question, guys. Every time they ask this question, how many minutes of physical activity you need to require. So the answer for that is 150 minutes a week of moderate intensity physical activity. So coming towards both aerobic and muscle strengthening physical activity are beneficial. Of course, guys, you gotta do the both. So I have seen people, they only focus on resistance training, they don't focus on the cardiorespiratory training. The word itself, it describes the cardio respiratory. The meaning of cardio is for your heart. You all guys, or most of the guys, train for the skeletal muscle, they don't train for the cardio. This is vice versa, guys. And those who people are the more emphasized towards the cardio workout or aerobic kind of workout, they should train for the the other physical activities like strengthening for their skeletal muscles. Health benefit occurs for children and adolescents, young and middle-aged adults, older adults, and those in every studied racial and ethnic group. Yes, guys, if you guys do the physical activities, it helps for the adolescent, young, middle-aged adults, older adults, and those in every studied racial and ethnic group. You heard me right, guys. The health benefits of physical activity occur for people with disabilities. Of course, those who have disabilities, like if they are handicapped or any kind of disabilities, even if those guys do the physical activity, they're gonna get benefit out of it. The benefits of physical activity far outweigh the possibility of adverse outcomes. So here with the table 1, we're gonna discuss health benefits associated with regular physical activities. It improves cardiovascularity, cardiorespiratory and muscular fitness, improve bone health, improve cardiovascular and metabolic health biomarkers, favorable body composition. So strong evidence what it does for children and adolescents is it improves the cardiorespiratory and muscular fitness. So what do you mean by cardiorespiratory and muscular fitness? It means, as I told you, the cardiorespiratory word describes is for the cardio, and muscular fitness, it means for your muscle, you know, other than your heart muscle, skeletal muscle, the muscular fitness. It improves bone health, it gives a very strong bone, then improve cardiovascular and metabolic health biomarkers. It means again for your heart, and metabolic means any chemical changes occurs in your body, that's metabolic. And favorable body composition, it means it reduces the fat percentage and increases your lean body mass. That is what it means. For moderate, evidence shows reduced symptoms of depression for children and adolescents. you know People those who are prone to depression, if those guys do the exercise or any kind of physical activity, whether it is strength training or cardiorespiratory training, they're gonna have the less reduction of depression. The coming towards adults and older adults, lower risk of early death. That's a good thing, right? Nobody wants to die early. So if you guys or nobody wants to die early, please do the exercise. Low risk of coronary artery disease, low risk of stroke, low risk of high blood pressure, low risk of adverse blood lipid profile, low risk of type 2 diabetes, low risk of metabolic syndrome, low risk of colon cancer. So all this thing, guys, prevention of weight gain. Yes, of course, if you guys work out, uh, of course, will not put on weight. Weight loss, particularly when combined with reduced calorie intake. Yes, weight loss is all about calories. How many calories are you consuming and how much are you spending. Prevention of falls, reduce symptoms of depression. This is a strong evidence if you guys work out. And the moderate evidence is low risk of hip fractures, low risk of lung cancer, low risk of endometrial cancer, maintenance after weight loss, increased bone density. So all this thing you can, it's quite easy, you can read on the chapter. So allied healthcare continuum, it shows like in this thing, what are the people who can help in working out, or something like dietitian ho gaya, nurses, physician. This is all we have to link with this thing. Physical therapies, athletic trainers. So here we'll be discussing like the role of scope. What are the role of scope for the personal trainer is, if anybody wants a diet, are you have a right to give a diet. If somebody have a back pain, or if he or she required a massage, do you have a right to give a massage? All this thing we are going to discuss, guys. Okay. The primary purpose of certification is always to protect the public from harm by assessing if the professional meets established level of competence in the knowledge, skills, and abilities. Yes, guys. See, you have a lot of apps nowadays. Then why do we need a personal trainer? It's personal trainer is for the protection from doing any harm. Guys, the the primary purpose of certification is always to protect the public from harm. You heard me right? Okay, for the professionals, a certification can separate him or her from others who have not proven themselves to be at the same level of competence. Yes, guys, like if he or she does not have a certification, and if you have a certification, you'll have a lot of weightage, right? So that is what it means. Coming towards the excuse me, coming towards the scope of practice. So what are the personal trainers can do and they can't do it? Personal trainer can diagnose? No, they cannot diagnose, guys. They can receive exercise, health, or nutrition guidelines from a physician, physical therapies, registered dietitian, etc. Yes, they can only give or help them designing a workout program, or they can just give a guidelines of nutrition. What, how many calories it consumes, how many calories it contains, from fat, carbohydrate, and protein, but they cannot diagnose. So, what do you mean by diagnose? It's like you got a client and you're telling them like eat so many amount of calories per day. You're prescribing them exact diet, like you eat this in the morning, you eat that in the lunch. This is not what we can do it, guys. We are not have authority. If you are doing it and if you find any kind of a problem, you'll be sued, guys. And a personal trainer cannot be prescribed. Yes, that is what I was telling you. Personal trainer, what they can do is they can design exercise program. They cannot prescribe a diet, or they cannot prescribe a medicine, or anything. They cannot prescribe it. They can only design exercise program, guys. They cannot they can refer clients to appropriate allied health professionals. Like if somebody wants a diet, they can tell them to have a nutritionist, or if somebody wants a massage, send them to a physical therapist. But you don't have any authority for that. Prescribe diets or recommend specific supplements. Yes, that is what I was telling you. Personal trainer cannot do that. What they can only do is general information on healthy eating according to my plate food guidance systems. Refer clients to a dietitian or nutritionist for a specific diet plan. Yes, they cannot tell them exactly what they can eat. Eat like 10 eggs in the morning. You cannot do that. We can only uh, tell them or give a guidelines, like in each egg it contains so much amount of protein, so much amount of fat. Treat injury or disease, personal trainer cannot do that. They can refer clients to appropriate allied health professional or medical practitioner for treatment. What else they can do is use exercise to help improve overall health. Help clients follow physician or therapist advice. Yes. Monitor progress for medically referred clients. This is what personal cannot do that. What else they can do is document progress, report progress to appropriate allied health professional or medical practitioners. They cannot rehabilitate, they cannot counsel, they cannot work with patients. What they can do is design exercise program. They can only coach. They can provide general information, refer clients to a qualified counselor. These are the 3 to 4 important things, guys. Just remember what personal trainer can do is they cannot diagnose, they cannot prescribe, they cannot do anything which is out of scope of practice. They can only give a guidelines of nutrition. They can only give a design a program. They can suggest a client to a allied healthcare. They can work with patient. You guys have to only coach. Oh no. So guys, we're gonna stop here. So if I get a lot of motivation from you guys, if I get a lot of support, I'll try to finish this book. So this is my first video of first chapter. So please let me know, guys. Give me a review I know what are the improvements I have to do it. I know this is not my best video, but I'll try my best. Thank you guys. Thank you so much for watching my video. Thank you. Bye.